Hi everyone, welcome to another webisode of The Good Doctor on eZeLiving.com. Today I'm in the company of Dr. Hady Jerdak from Harley Street Medical Center. Welcome to the program.
Thank you.
Today we're going to be talking about sleep apnea.
Yes.
What is it? How do people get it? And what is the cure?
Sure. What is it first? Sleep apnea, by definition, apnea is no air. So sleep apnea, it's no breathing, basically, while you are sleeping. So there's the apnea where there's no air passing through for more than 10 seconds. And there's another word, it's called hypopnea, which is a decrease in the air entry for more than 10 seconds.
So how does this air get blocked where we stop breathing?
There's two main parts of sleep apnea. There's the central part, which is the brain doesn't send the signal to the lungs to breathe. That's called central sleep apnea because it's from the center, from the brain. And there's the obstructive sleep apnea, which means that the brain is sending a signal, but for some reason of obstruction, the air doesn't go in. So the patient is trying to breathe, but no air comes in. Central sleep apnea comes in certain patients where they have either congestive heart failure, like the failure of the heart, or they have had a stroke in the past, bleeding in the brain, or a CVA. And these patients, the center of breathing in the brain is damaged in such a way that it stops sending regular signals to the breathing muscles to breathe. This is a small part of the population has this, and they have to have these predisposing factors. There's other types, but they are really rare. Whereas the obstructive sleep apnea, it's a totally different thing. The function of the body, the function of the brain is functioning well, but for one reason or another, at night, when they lose the control of the muscles of the airways, this airway blocks.
And we're talking about the tongue here.
It's not the tongue, it's between the tongue and the larynx. The tongue is involved for sure, but this area, during the day, it's open for multiple reasons. The muscles we open it, and it's a natural opening. However, at night when we sleep, we lose the tone of these muscles and they tend to relax. And in certain people, the opening is already tight, and when this relaxation happens, when this loss of tonus of our muscles happens during the night, it leads to an obstruction. If there's a total collapse of the airway, that leads to a blockage of the breathing. What happens? And that's very interesting. Suppose there's a blockage of the breathing. What happens? We're not breathing. The oxygen will drop down.
Sure.
It will drop down to a critical stage where it will trigger the brain to wake up. It's a micro arousal. It's a small, tiny arousal that we don't feel, we don't remember. And with this arousal, we regain the tonus of the muscles and we open the airways. We breathe a couple of breaths, it raises up the oxygen, then we fall asleep, and then it blocks again. So it's this repetitive motion, the repetitive obstruction of the airways that is the problem. If you ask me, in the normal population, does a normal person have sleep apnea? Yes, up till 5 per hour, it's normal. 5 to 15 apneas per hour is a mild disease, 15 to 30 is a moderate disease, and above 30 it's severe. The symptoms are usually snoring. If a patient is snoring a lot, usually all women, they complain about their husbands. I can't sleep, he's snoring all night. Snoring is number one. 2, going to the bathroom at night, urinating, because during the night, every micro arousal pushes the adrenaline up. The adrenaline increases the urine production. So we go to the bathroom a lot. Morning headaches is very important, and tiredness. We're not sleeping. Every time we have an apnea, we're awake.
Yes.
So if all those symptoms are existing in a person, he should go and see a sleep doctor. When you go to see the doctor usually, depending on the probabilities, will ask for something called a polysomnography. What's a polysomnography? Basically, you sleep and we monitor everything. The breathing, the oxygen, the brain, the muscles and everything. And during this night where you're sleeping at the hospital and being monitored, we can establish the golden number. How many apneas are you doing per hour? And depending on this number, we can take a decision on the cure and on the treatment. For instance, if a child has a large amount, and I have lots of children they suffer from sleep apnea, we don't cure the sleep apnea, we cure the reason behind it. For instance, if they have large tonsils and adenoids, we send them to the ear, nose, throat doctor to remove these things, so to clear the airways. If they have a retrognathia, if the jaw is pushed back and he's young and thin, we send them also to the surgeons that might do an operation to push this mandible to the front. These are types of the treatment, and depending on the people. For the adults, the obese adults, we cannot use the operations. The operations doesn't help because the airway is really very tight and it's due to the obesity. Now, losing weight is a very important factor, but when they have a severe sleep apnea, we need to apply the continuous positive airway pressure. It's basically a machine that sits next to the patient at night, and it's through a tube and a mask put through applied to the nose, and it exercises a positive airway pressure that prevents the obstruction. So this is very important for the adults, and we follow them through bit by bit until they adapt to the machine, and we push them to lose weight and to go back to their sports and the good habits of life. This is the main treatment. The dental appliances is reserved for a special type of patient, for a special people who cannot tolerate this machine, for example, who have moderate sleep apnea, 20 per hour, and who cannot tolerate the machine. So we might go for that option. Knowing which patient, what to do with them is very important, and that's only the doctor who can decide this.
So the symptoms, the first symptom is snoring.
Yes.
The second symptom that probably most adults would experience is fatigue in the morning. And if you have these experiences, they should come and see a doctor. My final question to you is, what is the threat and the danger if someone doesn't recognize that they've got sleep apnea?
That's an excellent question, by the way. The night is made for the body to relax. During the day, the heart, for example, beats between 80, 100, 120, depending on what activity you are doing. During the night, it has to beat 50 to 60. It relaxes. The same for the brain, the same for the breathing, the same for all the organs of the body. And the fact that we're having sleep apneas 30 times per hour means every 2 minutes, it's as if you're running a marathon. So the whole night we're tired, and that leads to major problems. High blood pressure, heart problems, CVAs, meaning cardiovascular events in the brain, cerebrovascular events in the brain, diabetes, chronic fatigue, loss of their job. Their libido also will decrease, so their wives won't be happy.
Sure.
You know what I mean? It affects the whole organism. It's just the fatigue that is installed that eats the body from inside, and the treatment is to prevent all of these.
Well, thank you very much for this insightful information. For all of our viewers, if you've got any questions or concerns about sleep apnea, please leave them in the comments section down below, and we will be happy to answer your queries. Thanks for watching The Good Doctor on eZeLiving.com, where you can find anything and everything lifestyle.